Hi, so today we're going to talk about infestations and bites in common dermatological conditions. First up, we have pediculosis and nits, which is just a fancy term for lice. They can be anywhere there's hair, so the head, the body, pubic area. Risks include close contact with anybody that's infected, sharing of hats and accessories. Symptoms are typically, they can appear over a couple days. They can be itching, tickling around the scalp area, red bumps or sores. In order to find the lice, we typically go through the hair with a fine-tooth comb and a pen light. Lice will scatter when light exposes them, and then their eggs, the nits, those are usually the size of a grain of salt, and they're stuck to the hair follicles. As you can see, here's the nits, the lice. First line treatment is over-the-counter permethrin lotion, or NYX, and we want to retreat them in 7 to 9 days because while this lotion might kill the active lice, it doesn't always kill the eggs. Second line includes prescription treatment. Once again, you use it after shampooing and leave it on for a little bit. Alternative therapies, people have said mayonnaise, petroleum jelly, and olive oil help. Make sure the patient knows that everyone in the home should be treated, brushes and combs should be treated, and anything that's non-washable should be placed in bags. Avoid NYX in patients that have ragweed or chrysanthemum allergies. It can cause skin irritation. Quality of life, it can cause intense itching, sleep disturbances, and also anxiety. There is a stigma around it. People are like, oh, it's dirty, but the patient can't help it. Scabies, these are little mites. They're usually the size of the tip of a needle. Close contact with an infected person, sharing bedding, clothing, towels. Again, this is very similar to lice. Exam findings, itching, little papules, and they also like to burrow. So as you can see, here's the burrowing, here's the papules. Treatment includes, once again, the permethrin cream, only you put it all over your body. Second line is oral ivermectin. Tea tree oil, clove oil, and aloe vera are alternative therapies. Everyone in the home should be treated, clothes should be treated, and non-washable items should be treated. Once again, we want to avoid in patients with any type of allergies. Also, ivermectin can cause CNS toxicity. Intense itching, sleep disturbances, anxiety, once again, similar to lice. Bed bugs. These are little reddish brown bugs about the size of an apple seed. Same thing, infected person, bedding, clothing, towels. Itching. The difference with bed bugs is we say breakfast, lunch, and dinner, which means they like to bite in little kind of threes here. Like, as you can see, breakfast, lunch, dinner. That's kind of a way we tell that it's bed bugs. They typically resolve on their own. Anti-itch remedies is something we also want to consider. Cortisone cream, things like that. People say that these oils help. We also want to tell the patient to treat everyone in the home, wash everything, and consider an exterminator. Once again, itching, sleep disturbances, anxiety. These are other common bites. We have fleas. As you can see, they're kind of clustered. They're typically localized to lower legs. Tick bites, we look for the bullseye rash. We need to consider Lyme disease or alpha-gal. Mosquito bites, these are little papules also, just things to make the patient aware of. Make sure that you tell them symptoms of Lyme disease, to look out for the bullseye rash and the doxycycline treatment for that. Here are spider bites. We have widow spiders, recluse spiders, and barn spiders. So wooded areas, attics, closets, shoes, things like that, they like to hide in. Itching, burning, blisters, things like that. Typically, we do an examination. We can do an ELISA test, and we can also do cultures. This ELISA test tests for enzymes. Here we have the different types of spiders and their bites. Typically, they resolve on their own, but if it's severe enough, we'll do antibiotics. Rose oil, lavender oil, and aloe vera are also treatments. Consider if the patient has an antibiotic allergy. We want to monitor the wound and tell them to clean and apply cold compresses. Consider tissue damage, pain, and sometimes it can take a while for them to recover. All right, thank you.